Claudia, you just give me a signal when it's time for me to start yammering.
Welcome, everybody. Thank you for joining us today. We're going to allow a little bit of minute or so to allow folks to enter the webinar. If you are attending by phone today, please send us an email or um, put in the chat your first and last name so we can grab your attendance.
Claudia, as we're waiting, is it okay if I provide an overview of some statistics about today's webinar? Great, thank you. Welcome to everybody. We are so pleased that today we have 720 registrants for our 13th National Town Hall, which makes this our largest student body by far today. So we're very, very excited to have such a large audience. Where are folks from? We have 49 of the 50 states represented, and also Washington, D.C., my hometown. We have registrants from 10 other countries representing North America, South America, Asia, Europe, and Africa. So good morning, good afternoon, and good evening to our international friends. In polling our folks, just over 40% of registrants work in victim services or victim advocacy, and about 20% are in emergency planning and management. In terms of folks' experience related to mass violence incidents, exactly half live or have lived in a community where they experienced a mass violence incident, and 38% have actually themselves responded to a mass violence incident. Um, a statistic that warms your presenters' hearts is that 61% of y'all have been involved in helping your community to develop a plan for mass violence incidents. And 19% of folks registered today themselves or their families were directly affected by a mass violence incident. So thank you all for completing our demographic survey. It's very interesting for us to know who's who when we're hosting a national town hall. Okay, are we ready to rock and roll, Claudia?
Yes, ma'am. Go for it.
Okay.
Next slide.
So thank you all. This is sponsored by the National Mass Violence Center, and we would be remiss if we did not express our ongoing continual gratitude to the U.S. Department of Justice Office for Victims of Crime, and specifically our program manager, Eugenia Pedley, for their amazing support for the work that everyone that's presenting today does on behalf of mass violence victims. The ever popular housekeeping announcements. We are recording this national town hall, and we have live ASL interpretation. Closed captioning is available to all of you, so please go to your setting at the bottom of your screen and turn on closed captions. You'll see it's available in multiple languages. After we post to our website, the recording, the slide deck, and a pretty robust resource page will be available for download at our website. And as Claudia said, if you're joining by telephone, please email us at this email address with your full name and your email address so that we can make sure you get credit for attending. And we are so grateful to so many of you who sent wonderful questions to our presenters in advance. We are going to make sure to save time at the end to answer the most frequently asked questions. We have three, I think, really important learning objectives today. We're going to start out by talking about the core planning activities that are needed to establish each center. And I know you all are very interested in the federal and national resources, including funding that support each center. Next, we're going to identify specific services and support, including the similarities, but also the differences among the centers that are provided by a Friends and Relatives Center, a Family Assistance Center, and a Resiliency Center. And toward the end, I'm going to do a little wrap up and talk about the importance of a seamless delivery of case management and victim services across the continuum of the three centers. We have just an amazing group of presenters today. I am so proud to call them my friends, my colleagues, and my sisters, starting with Dr. Angie Moreland, who is our Associate Director and also Director of Improving Community Preparedness Division at the National Mass Violence Center. We have Krista Flanagan, who is a Senior Criminal Justice Subject Matter Expert for OVC's Training and Technical Assistance Center. And we have Dr. Stacy Beers from the FBI Victim Services Division. Stacy is the acting unit chief of Terrorism and Special Jurisdiction Unit. And we are so grateful to our ASL interpreters, Kelly Marsh and Greg Rodriguez, for joining us and supporting our efforts today. We surely appreciate you all. That's me. And me, I'm so proud to introduce Dr. Angie Moreland, who's going to talk about core planning activities. Angie?
Yes, good afternoon, everyone. Thank you so much. And thank you, Anne, for that wonderful introduction to our topic today, which I probably say this a lot, but this is one of my favorite topics. And I'm just extremely, extremely excited to share this with all of you and to kind of share how we walk through these different centers. So I'm going to start out with talking a little bit about the core planning activities necessary to establish each center and the federal and national resources that are available. And I also will touch a little bit on kind of how this town hall in and of itself, but more so this entire topic of having this town hall and having these joint discussions kind of came about. So just to start out, the National Mass Violence Center, many of you who have been on these town halls have heard our mission and heard kind of a little bit of history about what we do in the past, but especially for those that may need a reminder or those who have not been tuned into any of our town halls before. The National Mass Violence Center is funded and is a cooperative agreement with the Office for Victims of Crime. And we were developed or established in 2017. We have a lot of missions and a lot of goals, but our main focus is really around developing and providing evidence-based programs, services, and strategies specifically to address and to work with individuals and victims and communities who have been most impacted by mass violence. So to do that, one of our main charges or one of the main focus points that we do is help to identify and meet the needs of individuals, communities, victim service providers, behavioral health and mental health providers, first responders, and all of the others. As we know, mass violence has a pretty extreme ripple effect across entire communities. So we really focus on trying to meet the needs and identify those needs of people across entire communities so that we can work most closely with the impacted individuals and victims who were present or who were impacted by mass violence incidents. One of our main goals of the National Mass Violence Center and kind of one of our main expertise points is around the behavioral and mental health impact of mass violence exposure. So our faculty and our consultants and kind of everyone that we work with is very focused specifically on kind of that mental health impact. And that's been a major goal is to help to identify those needs amongst victims and survivors in mass violence communities. And then also to build and sustain partnerships. And that's for mass violence across the entire spectrum. So from preparedness and planning, which I'm going to talk about a little bit today, into response, and then all the way through the recovery and resiliency standpoint. So as people may be aware, mass violence is not a short-term impact area. So when a community is impacted, there's planning that comes forth, but then also when it comes to response, recovery, and resiliency, it's a long road, and there's different needs at each stages of that. And that's, I think, one of the main focuses today is how these centers and these different areas can help walk people and walk communities through these different stages. So the preparedness piece in and of itself, one of our main take-home messages is and one of the main things that we talk about from a preparedness standpoint is almost every single community that we have worked with. I would say every community, but I don't want to overgeneralize, but I think it is every community that we've worked with on the response side. So after a mass violence incident occurs, they always say something about planning. And we hope that it's a positive statement about planning, that, this piece went really well because we had planned for it, or these partnerships that we had built prior to the incident occurring were really integral to the response after the incident. But unfortunately, sometimes it's on the other side as well, that I wish we would have planned more for this, or we didn't recognize as a community the importance and the need to plan for these particular areas. And normally it's around the victim services, and normally it's around that long-term impact. So many people, you don't know what you don't know as a community or as a victim service provider, or any other providers within a community. That comes to providers themselves, but then also law enforcement, emergency management, kind of across the board, different areas that will be impacted and also will be involved in the response to a mass violence incident. They don't always understand or don't always know what they don't know, like I said, as far as what is needed in preparing, and specifically what is needed from a victim service standpoint, and to address the short and long-term impact of mental health across individuals and victims in a community. So, this division of the National Mass Violence Center, our specialty and our expertise is specifically in providing individualized training and technical assistance to assist areas and communities in a broad range of areas that can help them become more prepared. So we help to develop partnerships, to develop policies and procedures so that they can proactively prepare to meet the needs of victims from the minute the mass violence incident occurs all the way through years and years later. And then also to expand the capacity of agencies and local governments by providing supplemental resources for those who want to augment their existing emergency management plans. I think most places that we work with will say we have an emergency management plan. Sometimes it includes mass violence specifically, in addition to kind of other types of disaster or other types of mass casualties. But even when it does include mass violence, many communities will say, we have an existing emergency management plan. It addresses mass violence. We update it yearly, but we still are able to come in and provide some assistance to those communities and be able to look at it and identify if there are additional victim service needs that are there and how we can assist to help review and augment those specific plans. So within this division, we do a range of training and technical assistance. We provide webinars, we provide virtual and in-person trainings, case studies and scenarios. We review those emergency response plans. And we also provide both short-term and long-term training and technical assistance. So essentially what we do when someone approaches us, and it can be at any level. So we work with states, with cities, with counties, with school districts, universities. We've had some hospital systems. So any entity that comes to us and says, we would really like some assistance, we kind of approach it as an A to Z model. So we can provide a few pieces of training and technical assistance around what's needed to fill gaps in their emergency management plans, or we can work all the way from A to Z and say, we're going to sit down with you and go through every single component in training, and we may need to go in depth into some areas and not as in depth into others, but we're really going to work with you to make sure that your emergency management plans are ready to go and include all of those victim services components. In doing this, there's a few lessons learned from a preparedness standpoint. You're never fully prepared, so we recognize every community that we work with in saying, this is so great. We have, it's wonderful that you're planning. It's wonderful that we're prepared, and now we have this beautiful plan and everyone's practiced the plan. But we also are very well aware that no matter how prepared you are, it can still be extremely chaotic. But if you are prepared, even though you're never fully prepared, at least you're one step ahead. And at least you have a lot of information that you would not already have had. The importance of a collaboration cannot be stressed enough. Collaborating among partners in an area or in a community before, during, and after the mass violence incident. We've really learned that these plans have to be flexible and adaptable. It would be wonderful if we could say, here's how you do a plan and just follow the script and go through these modules and you'll have it perfectly. But as we know, that's just not the case. Every community is different. And Krista says this a lot in working with her. And I know that many other points have, or many other experts in this field have. But what we've really learned is if you've responded or you've worked with one community after a mass violence incident, you've worked with one community. They're not all the same, and you have to be flexible and adaptable. Every experience is different. Every community is different. And you really have to identify who those leaders in a community are. So we can go in and have a lot of very well-meaning, very passionate people in a community who want to have their community prepared and really want to develop these plans. However, if they're not the leaders and the ones that can make change and can impact across the board, then a lot of change and meaningful, long change isn't going to happen. Also, we need to work with those, manage those expectations, manage the politics. We know every single community has their own politics and every community is different. So making sure that we work individually with those communities. So that being said, although it is flexible and it is different, we do have several areas that we really have learned as far as what are the best practices. And these have been established in the field, and kind of the pieces that we really pull out as far as if you are really wanting to plan and effectively prepare, here's the areas we need to focus on. 3 of those main best practices, which I'll show an overview of all of those in a minute, but I think one of the most important pieces is really understanding these 3 centers. And this is the whole focus of this town hall today, is talking about these 3 centers. So I'm going to provide a broad, just very brief overview of what these 3 centers are. And then talk about in a second that my colleagues and my friends on here will go into depth about these centers a little bit more. So these are the centers that are established in an area. First, the Friends and Relatives Center is established, and this is usually established immediately after a mass violence incident occurs. So it's often running for around 24 to 48 hours, and we'll go into depth about what happens at this Friends and Relatives Center in a second. That transitions into, or the community then develops, a Family Assistance Center, and it's really important to note that these aren't necessarily consecutive. So a Family Assistance Center can be operating concurrently at the same time as a Friends and Relatives Center is still open and running. Or it can happen right after, but it often does happen concurrently. As the FRC closes, the Friends and Relatives Center, then this Family Assistance Center remains open and can be open 7 to 10 days longer than this Friends and Relatives Center. And these are just ballparks. It's not an exact number. Every community, like I said, is different. And then we can move into a Resiliency Center. And this is generally established within a year of the mass violence incident occurring. And my friends will talk a little bit more about this in a bit, but it's in existence for varying lengths of time for various different reasons. This town hall, I'm excited to share this document with you. We recently, within the past 6 months to a year, really wanted to pull apart these 3 centers and make sure that we are consistent across the board. So as we're going in and responding to communities, the Family Assistance Center and the Resiliency Center were a little bit more common language. So people were using Family Assistance Center and were using Resiliency Center a little bit more consistently. People had a better idea of what those centers were, but not necessarily using the exact same definitions or common language amongst. The Friends and Relatives Center was the piece, many of you may know this formerly as a Family Reunification Center or just as a Reunification Center in the past. we had pretty resounding, both us and all of our partners had pretty resounding feedback from victims and from communities that the word reunification, that language really does matter. And although reunification does occur at a friends and relatives center, and that is one thing that can occur there, a major problem is that everyone is not reunified. And across the board, reunification, that's not the only thing that's happening at that center. So we got together with our partners at the FBI, Victim Service Response Team, NTSB, American Red Cross, OVC TTAC, and all of our different partners that we work with, and really wanted to come up with some common language on, if we're not going to call it a reunification center, then what are we going to call it? And that was what we kept hearing from communities is, we hear that, we understand that we can't call it that, but then what do we call it, and how do we call it this when FBI may call it this, or OVC TTAC may call it this, or different areas may call it different terminology. So we came together and really wanted to come up with some consistent terminology. And that's one thing that an ask of everyone on the call, if I can have an ask today, is just to thank you and to ask to be consistent in this language across the board, that we really are wanting people to be consistent and making sure that they understand this language. So this is our overall best practices. I'm not going to go through these today, but if anyone's interested in further planning, please let us know, and I'm happy to reach out and talk more about this. We also do have a town hall about this as well. So within our best practices, the Family and Relatives Center, or Friends and Relatives Center, the Family Assistance Center, and the the Resiliency Center, those three best practices within our planning, we can work closely with communities in doing these, but I'm going to leave it up to my friends, Krista, Stacy, and Ann to really talk in depth about what those are. So this is our preparedness or ICP TTA website. So I just am popping this up here really quick for if anyone does want to hear more information about those planning and preparedness work, or that training and technical assistance that we can help to assist you with. And I'm going to turn it over. So thank you.
Great. Angie, thank you so much. And rumor has it that your division is now working in 39 communities.
Yes, we are.
Okay, that is
And you're muted for some reason.
the fact that you're offering such a wide scope of services and support to these communities is really pretty amazing. So thank you for that, and thank you for your presentation. And boy, am I excited to welcome Krista Flanagan, who has over 30 years experience specifically in the mass violence field, and her work with OVC TTAC is such an important part of our partnership. So Krista, welcome, and thank you for talking about Friends and Relative Centers.
Thank you so much. I appreciate that introduction. 30 years. Wow. That means I started when I was 10. But it's nice to see everybody today. Thank you so much. It's an honor to be here. I'm going to be talking with you today about the Friends and Relative Center. Go to the next slide, please. So the Friends and Relative Center is what, as Angie had stated, was formerly known as a reunification center, and for very important and sound reasons that Angie explained, that name has been recommended to be changed. And some communities will also might choose to use information or notification centers, or information centers, notification center, as long as the community has an understanding of what each center is what's important. But the idea, again, to try to standardize a language is important as well. But it's really critical to kind of avoid the reunification term if possible, because unfortunately, not everyone will have the opportunity to be reunited with their loved ones. A Friends and Relative Center is a safe place for families who are in search of their family members or loved ones for information. And it should be open as quickly as possible after an incident occurs. Now, I'm going to talk a little bit in a little while about the incident command structure, but an incident command or your core crisis team often determines the need for an FRC as well as the location. And an emergency operations center, also known as an EOC, should also be initiated as early as possible to help coordinate and set up survivor care. all, of course, in coordination and collaboration with victim services, because a best practice is within the incident command structure is to deploy a victim assistance liaison to that incident command to coordinate their role as well as their response. So incidents of mass violence, as we know, involve multiple victims. And, there might be physical casualties and fatalities, as well as those who are emotionally and psychologically impacted. And all of these individuals will be in need of some type of assistance. And what you want to make sure is that the processes for identifying and tracking victims is something that is done that's centralized, and that would be at this Friends and Relatives Center, because people are coming primarily for information about the location primarily of their loved ones, but also looking at that identification component. And this is a massive undertaking. So having processes in place ahead of time for having to manage the missing individuals is important, as well as those that can be found. And so this goes back to what Angie was talking about the importance of planning. So as much of a structure that can be put in place ahead of time is what's recommended as a best practice. And because we want to look at that, notification would include involvement in the incident, as well as the injury, hospitalization, the missing status of individuals or death notifications, positive victim ID, or presumptive death if a victim has been unrecovered or unable to be identified. We have to look at a comprehensive list of victims and victim survivors, their families, as well as others that are affected by the incident, that would be recorded in hospitals, as well as morgues and the FRC, and as well as those that are self-identifying that are be seeking services. And this information would be, carried on into the longer term recovery. When we look at this centralized system, it's important that be consistent from the beginning for the victim tracking services. This is going to help reduce the chaos that just is inevitable in these types of incidents, and also will increase the speed in which connections can be made and notifications can be made to individuals. Now, victim lists, this is so important. Victim lists should not be the sole responsibility or solely held by law enforcement or the prosecutor, because this hinders the ability to share that victim list with those that are providing services and looking at that continuity of care. So it's to have memorandums of understanding about how those victim lists will be shared ahead of time is really helpful, because victim identification notification is a core function of the Friends and Relatives Center, as well as the Family Assistance Center. Also at the Friends and Relatives Center, that there are going to be other types of services that are going to be offered. And we're looking at disaster-trained behavior and mental health services, as well as disaster-trained spiritual care. And they're really their role is so important to provide guidance and support for religious as well as cultural handling of remains and burial. Also at the Friends and Relatives Centers, some people will be actually reunited with their loved ones. And oftentimes there are death notifications that are done within those early hours. And we'll talk a little bit in just a second about that. When we look at death notifications, that oftentimes they take a little bit longer when you have mass fatality. But, the sudden and unexpected death of a family member, as you all know or could imagine, is one of the most traumatic events that can affect an individual during their lifetime. And assuring that the needs of these survivors are identified and that every effort is made to meet these needs is really a monumental task. This is where that planning and preparation is so important, for that compassionate and dignified notification. And that this would really help with accessing information regarding the death and making sure that this is consistent and meets the basic requirements for mitigating the trauma that results from these unexpected deaths. Fatality management notifications it's important to know, are governed by state law. These plans should align with existing state laws and protocols, and there should be coordination with the local medical examiner or coroner. This is essential. Some jurisdictions have agreements that permit victim advocates to assist with notifications, but often law enforcement is tasked with this. Other jurisdictions have protocols that allow for only medical examiner, coroner, or law enforcement to do the notification. Whatever the situation is, the best practice would be to include trained, vetted, and experienced advocates, behavioral health, or spiritual care providers, because this can be a beneficial partnership for the notification. Now, when we think about notifications, that there are some unique aspects for mass fatality notifications as compared to individual victimization. So we look at of course, there are multiple victims and more intense reactions. There is a much longer time to wait for identification of bodies, and depending on what the form of death is too, that it might be difficult sometimes to identify bodies. And so and you want to make sure that they're accurate. And there are more individuals that are seeking information, therefore more trained individuals are needed as well. We also recognize too that in these incidents that there is widespread misinformation via social media, and this happens immediately, which is why I want to talk about this here in this section, because one of the greatest challenges for providers is to manage this widespread misinformation on broadcast media as well as social media, but especially social media. So obviously that this can create a lot of stress. It can exacerbate the existing trauma. And family members should be informed right away that this information that's on social media is not verified information, and they can be encouraged to try to avoid viewing it. They should also be made aware that the information coming out of the FRC is verified, where social media and some broadcast media may not be. Oops, sorry. So a family or friends and relatives center also, as was mentioned earlier, is something that is something that's open for a short period of time. It's a spontaneous location because incidents of mass violence are unpredictable. You don't know when and where they may occur. So as Angie mentioned, even though a plan is valuable, it's hard to predetermine where a location of an FRC may be because you don't know where the incident is going to be. The incident commander is going to determine really the location of an FRC. So I just want to spend a little bit of time talking about the incident command system, or also known as ICS. So the incident command system is the most widely used and accepted emergency operational structure in the country. It allows us to speak some of the same language and to follow the same protocols to respond to an incident, no matter what state or town you live in. There also might be internal ICS set up within an individual agency or organization, but there's really only one incident commander during a response. So it's important that you know who that is and what that structure is within your community, and is victim services a part of that? We recommend that if they aren't, that victim services should be. The incident command system is designed to aid in the management of all resources right from the beginning. And this is during the emergency stage, that acute stage. And it comprises of elements of facilities, equipment, personnel, procedures, and communications. Now, within this structure, it's important to note that your organization or your agency may communicate to different audiences than you're used to. And you need to make adjustments when delivering this message to service providers and first responders to the public. And you have to know too that you can only disseminate information that you are authorized to release. Remember, you're no longer working within the boundaries of the jurisdiction that you're in. Rather, you're working within the incident command structure, and the information you share is going to be determined based on that structure. You must recognize that what the legitimate sources of information are and the roles that you have and what you have within the FRC. Speculation, especially in those early hours, can circulate and rumors will fly. So recognizing and acknowledging the sources of legitimate information are going to prevent you and your organization from working off incorrect information. Also, understanding how to use that disaster-specific information, trauma-informed approach within services is important. Victims are a common thread for everybody who's responding to an incident. And so we're all responsible to make sure that the response efforts are following that coming through a trauma-informed lens. So why is this important for you to know? Why did I go over this? It's because, as previously mentioned, the incident commander is going to determine where the FRC is located, and this is going to be based on safety, convenience, and access. And in the planning, it may be determined that there's a core crisis team, which should include emergency management, and they might be the best place to, the best organization to help locate, secure, and stand up an FRC. The best practice, as I mentioned, is to include victim services in the planning. So with the location, the FRC should be located near the scene, but ideally out of sight and sound of the scene. But it should be accessible to survivors and victims. People are going to show up at the scene. We know that. And they're more likely to leave the scene if they know that it's a location, the number where they can get information that's timely and accurate, but someplace that's relatively close and easy to get to. So sometimes, depending on the scope of the incident and the size of the incident, there may be multiple centers, but just knowing where they are and that they are legitimate centers, because some will spontaneously pop up that aren't necessarily legitimate or authorized by the incident commander. As Angie mentioned, that these are typically open no more than 48 hours, sometimes up to 72 hours. Oftentimes they do transition into an FAC, but sometimes they can be run at the same time. During at the FRC, it's communications is key. Also, registration and badging of the service providers that show up, as well as information and briefings. So who are the service providers? Well, victim advocates, definitely victim services professionals, law enforcement, the disaster and mental health and behavioral health providers, as well as the spiritual support providers. Also limited food and beverage. People need to be hydrated, and security. Providers are going to be working side by side with law enforcement to coordinate support for victims before, during, and after interviews with law enforcement. When deployed, providers should report to the location of an FRC where they were going to be credentialed and badged. They're going to assist family members in notification and provide that pre-approved authorized information. They will also implement and utilize that data collection process to track the number of victims and the families contacted, the services that are provided, as well as the agencies that are involved. Ideally, providers are going to be trained and vetted prior to an incident. Affiliated or pre-identified agencies should have a list of these professionals to be deployed. Now, what's important to remember is that providers, even if trained, should not come to an FRC or any of the centers unless they are deployed. This is why a best practice to have that plan ahead of time identifies the process for service provider deployment and credentialing. So who is going to show up at a center other than those that are the service providers? Well, obviously victims that may go, they may be told that that's where they might be reunited with their loved ones. And so those that have been directly impacted, family and friends, many more than just the next of kin, that there are going to be people that want information. And there are going to be some people just wanting help and trying to find out where their loved ones are. There are also going to be curiosity seekers, that people are that are just nosy and want information. The media is going to be there. Politicians oftentimes will show up. They usually will show up at the incident command. And, when we say everybody and their dogs, people will show up with their support dogs. And really this is something that needs to be discussed early on related to planning, because you want to make sure that you have the right kind of service dogs that are there. I'm sure Stacy is going to mention this when we talk about family assistance centers, because not all dogs are appropriate to be at these types of facilities. So as I wrap up, I just want to kind of talk about some of the needs and expectations that we look at, that at this stage, accurate and timely information is the primary need. processes are needed to identify and track those large numbers of victims and survivors. And while mental health intervention is not what's needed and wanted by most at this stage, it still should be available, and having those individuals there that they can still meet the other needs that victims have, and having the ability to manage those people that are going to show up that may not be the best suited, because there's going to be a lot of chaos. There are going to be many people that are going to want to tell their stories. There are going to be a lot of people that are going to show up that think that they know what to do, but they haven't been trained or vetted. So making sure that there's a plan in place ahead of time is what's important, because there are going to be a lot of good people that will be there that want to do good work, but may not be the most appropriate at this stage, but might be really valuable later on down with their response. So as I mentioned, that the FRC is only open to it for a short time until it transitions to an FAC. I know this is kind of, the acronyms are sort of confusing, but now we're going to be talking about the FAC, not the FRC, and Stacey Beers is going to discuss that. Thank you for your attention.
Krista, I want to say thank you for providing so much information, and also the words you use, massive undertaking and chaos and unpredictable. It's important that people know that, because unlike the other two centers, you barely have a hot second to get the FRC set up.
Right, that's true.
Yeah, so it's very important to know that everything that Krista just told you about, take to heart, because it's really going to help you set up the FRC. And yes, we are very excited to have Dr. Stacey Beers talk about FACs. And I will say personally, in my experience, whenever the FBI victim response team shows up at a FRC or FAC, I breathe a sigh of relief. So Stacey, thank you so much for being with us today.
Thank you guys very much for having me. And I see a lot of my FBI Victim Services Division folks on here. So it's really great to see everybody. So thank you very much. I am not going to turn my camera on because my Wi-Fi is a bit wonky right now. And I'm afraid if I do that, I'm going to crash. So there's a photo of me and my partner in crime, Wally, and I'll talk a little bit about him as we go through the next few slides. Next slide, please. Next slide. So what I'm going to talk about is a little bit about our victim assistance program, our victim services response team, and then FACs. So next slide, please. Next slide. So just an overview of the Victim Services Division in the FBI. We were established as a result of the Attorney General guidelines on victim and witness assistance. It has been updated. And so we are mandated by the Attorney General guidelines to identify victims, to notify them of case events, and provide resources and referrals to community services. And that's really important when I start to talk about family assistance centers, because most of the times we are supporting local authorities who are working with victims through a request that they give us through the 2012 Investigative Assistance Act. Very rarely is the FBI Victim Services Division setting up any kind of a family assistance center. Sometimes we do, but it's not all the time. And so what I'm going to do is share some of the lessons learned and some of the best practices that we've actually learned as we set these up. Next slide, please. So who are our victim specialists? We have about 175 victim specialists throughout all of our 55 field offices. We work in partnerships with our agents and task force officers so that we can assist victims in crimes that they identify and victims they identify. We're available 24/7. We provide on-scene assistance to victims and families. So oftentimes what you will see is you will see some of our victim specialists in those FRCs, as Krista talked about. I'm trying to just figure out who's showing up, what the whole need is, what are some of the unique circumstances of this case, what are some of the unique circumstances of the community. We will provide the on-scene assistance to victims and his families. If asked, we don't just descend. So if we are in an FRC, chances are we've been asked to be there by our local folks. We interact with our local, state, and federal partners, obviously our NGO service providers. And, and when it comes to victim services, a lot of our victim specialists can act as subject matter experts depending on their backgrounds. Next slide, please. Next slide. So we have a victim services response team. It's a multidisciplinary team. I know a lot of us in victim services are used to working with MDTs. Basically, what we have is we have a rapid deployment team that includes victim specialists. We have analysts, and we also have agents, and we all have different kind of nuances. So our victim specialists are the ones that are providing the on the ground direct services to victims. Our agents sometimes are working in command posts. They're helping with the return of personal effects. They're working in, they're providing briefings and things like that to leadership. And then we have our analysts, and they basically keep the wheels on the bus. They're the ones that are assisting us with victim lists. I know that Krista talked about that. We could do a whole thing on victim lists. It becomes very complicated with sharing victim lists. As a victim advocate, victim services providers for over 30 years, I'm used to working in nonprofits and police departments and things like that. Coming to the FBI, when we're talking about victim lists, they actually have our PII, or these are the personally identified information, and by law we have to protect that information. So sometimes it becomes a dance that we walk with locals. We completely understand that you guys need the list in order to provide the services to the victims. And we are like monkey in the middle when it comes to our general counsel to say, what can we release and how can we release it to make sure that victims are getting the services? So we do the best that we can. But I just wanted to highlight that based on some of Krista's comments. We have to be requested by our special agent in charge of that field office. We just don't show up. And so usually we are requested by some kind of a leader in the community through our FBI office on the ground before we respond. Next slide, please. So as Krista mentioned, these are our two favorite team members. This is Wally on the left, Gio on the right. I have been honored to work with Wally for the past 9 years. Again, we can do a whole town hall based on usage of dogs and animal-assisted interventions when it comes to victims. The FBI only uses facility dogs, not service dogs, not therapy dogs, and there's reasons behind all that. But as Krista said, they come out of the woodwork. And so it really can become a liability issue for those communities who, use different types of dogs. Not every therapy dog is the same. And so we have to make sure that we're very clear as to what the responses and what some of the liabilities can be. So when we are asked to support communities, we talk to the leadership there and explain to them why we use facility dogs, what the benefit is, and some of the liabilities related to that. Next slide, please. So what do we do as a rapid deployment team? Obviously, it's a lot like our victim services do on a daily basis. We provide on-scene assistance. We are assessing the needs. We are identifying some of the resources. We're also identifying the gaps. What are some things that we can't provide, but local resources can? We provide trauma notifications. We are able to coordinate support with hospitalized victims as well as families of the deceased victims, because often those are very different kind of needs. As I talked about, the development and support of the management victim list, that is ever changing. It always changes. We can facilitate the cleaning and return of personal effects, and I'll share some of that with you in the future slides. We can support family assistance centers. Generally speaking, again, we do not set up family assistance centers, and we can just morph into one that has been set up with our partners locally as well as the Red Cross. We can assist with the planning and management of family briefings. Victims have questions. We all know they have questions. They have a lot of things that they want to know, and it may be an open investigation, but gone are the days where we just tell victims it's an open investigation and we can't tell people about that. So we do family briefings. We have a whole protocol on site visits, what that looks like when victims want to go back to the sites. And then, of course, we collaborate with external agencies. We're not in this alone. We're obviously in this with our partners as well. Next slide, please. So here are some of the responses to date. You'll notice that the most recent one was a Bourbon Street attack in Louisiana. So that was the most recent, but our list it grows, unfortunately. But we're honored to be asked to come in and support. Again, we are only there for a short minute, and then we phase out and transition to the locals. Next slide, please. So here's our trauma notification protocol. We want to make sure that everybody can, establishes death and trauma notification as it relates to part of your planning. We have an online training. I will actually drop the website into the chat so that you have this. But we have a 4-step model that has been adopted through Mothers Against Drunk Driving, Concerns of Police Survivors. So we use this through all of our notifications. So we have most of our, I would say 85% of our field offices are trained in providing trauma notifications. We have trauma notification teams in each of the 85% of our field offices, so that if there is a mass violence incident, they can launch and they can actually help locals. We will only do this again if we were assisting them. Next slide, please. Next slide. So here's a family assistance center. I just want to kind of talk a little bit about what an FAC is. It is in a different location. Ideally, an FAC is in a different location than an FRC. And the reason for that is because in FRCs, there's not a lot of resources. It's where people just are directed to go. The other thing is in FRCs, a lot of times notifications are being made, whether they're death notifications, whether they're trauma notifications. So we want to kind of separate those things so that the FAC is more comprehensive. And so it's centrally located. It may not be as close to the scene as perhaps an FRC. We need to make sure it's accessible. We want to make sure that it's accessible on public transportation if people don't have vehicles and can't travel there. We want to make sure that we don't have it in a location where somebody has to pay $15 to park in hotel parking. We want to make sure that it provides support services from diverse providers. And we learn that through our morning and evening meetings as to what are victims asking for, what do we not have here as a resource, and how can we get those resources here. Also, this is private from the media and attorneys. This is not a place for the media, not a place for any kind of folks that are soliciting any kind of civil cases, things like that. What I will tell you is oftentimes when we set up an FAC, we usually let the media in before victims are in there so that they can show people what to expect. And so saying all that, this one that you're looking at right here is a photo of the Family Assistance Center that was in Las Vegas. Behind the curtain back there, you can see, well, you can't see behind the curtain. That was all of our personal effects. And so these tables in the middle are where victims would come. They would meet with a victim services provider. They would go through what their needs are, what they were looking for. And then around the perimeter, which you can't see, is where all of the resources were primarily sitting. And we would take victims around from there. What I will tell you is victims become overwhelmed pretty quickly. And so sometimes they might need to come back to a family assistance center numerous times in order to receive all the services that they're looking for. Next slide. So the purpose of an FAC, obviously, we can manage the personal effects and return of those personal effects. We have all the resources there. There's obviously support, there's communication, and we're able to identify and notify victims there. A lot of times we may not know who the victims are, but I can honestly tell you that, the victims show up here. We have agents oftentimes in law enforcement there that are able to do interviews and assess who these folks are so that we can make sure that we're plugging them into resources. Next slide, please. So what does it look like when you establish an FAC? The number of fatalities and serious injuries. Just so that you know, the average number of family members who show up per victim, per deceased victim, is 7. So if you have 10 deceased, you're already looking at 70 family members. That doesn't take into account injured or the present but not injured. So you need to be able to look at your communities and figure out where you can actually house a family assistance centers. Our victim specialists every year have to identify these locations in case we have to do this. We're able to do that. You obviously want to look at the impact of the community. How many people reside in the actual area in the Las Vegas attack? Quite frankly, only 20% of the victims actually lived in Vegas. Most of them lived outside. What's it look like to recover and identify the deceased and injured victims? How are we able to access them in the community? What's the location? Again, the accessibility. What does that all look like? I wanted to pop in here with some photos of some of the actual family assistance centers that we've supported. And so again, you got to look at when the FAC considerations, like who's in charge. Ooh, what just happened? Sorry, guys. There you go. Go to the FAC. No, slide 42, please. Who's in charge? Like, who's the one that is making the decisions? Can you go back for a second? Thank you. How do you decide on the venue? Oh, again, you should really look at your community to find out where you can house a family assistance center. Is there security and access? What are the hours? You want to let people know that. How long will you have it open? And again, we want to have large room for briefings, smaller rooms for the private matters. For example, the return of personal effects. You want to have an intake area, an area for PE storage, perhaps childcare. The American Red Cross actually contracts with Church of the Brethren. All of their folks are background checked, and they actually do great work with children. We want to have EMTs there and food and water. Next slide, please. So here's some of the messaging. I know some of you have questions about the messaging. This is the messaging we used in Uvalde. I was honored to lead this deployment on behalf of the FBI Victim Services Division with the Uvalde District Attorney's Office. It was an amazing experience, unfortunately, in a really bad time. But you can see how we did the messaging. Very basic. We made sure that it was translated into Spanish as well. So you want to make sure you know the community that you're serving. And we basically put out information as to what people can expect, what the hours are, and the location. Next slide, please. Here's an actual layout example. Again, we usually have the providers around the corner, around the perimeter. And we usually bring folks in. We control how they go in, and I will show you that on the next slide so you can have a visual of what it really looks like. Schematics are great, but let's talk about what it really looks like. Next slide, please. So here's the Uvalde Family Assistance Center. We had it at the Uvalde County Fairplex, and so you can see the big building on the left-hand side. This is what victims saw when they came in. Next slide, please. On the left-hand side picture, you're going to see what the table looked like. So this is a table where victims came in. The Red Cross would actually triage them, find out who they were. And then the middle and the right-hand side photos are photos of where the victim specialist would sit with the victims, assess their needs, and then take them around the room to actually get those needs. And of course, people send all kinds of things that they can do in order to, lift people up and give them good messages. Next slide, please. So I'm going to just talk really quickly about personal effects because I want to make sure that folks are being able to provide the rest of the actual presentation. Personal effects are items that a lot of times a victim last touch. They can only be returned to the family, and we want to make sure that we are giving them back to somebody because they have significant personal and monetary significance. Next slide, please. So here's some of the ways that we collect personal effects. You'll see that, there's shoe on the left. There's all kind of, personal effects related to technology. You have your cell phones, you have hats, you have all kind of things that people leave behind. Next slide, please. And what we generally do is, obviously, if it's evidence, we don't collect it. That's up to law enforcement. For personal effects, we want to give it back in a timely return. Sometimes people want the immediate needs related to jewelry, phones, things like that. We do our very best for that. We outreach to the victims about the personal effects. We can clean them. We have a contract with a company that can clean them. We return all of our personal effects in person, very respectfully. So the contractor that we use packages them in white tissue paper in white boxes, and then we send them out to our victim specialist who will go to the home or location that is actually provided by the victims where they want to meet, and then we go through all of that with them. So it's a very sacred time for a lot of these victims. Next slide, please. Oh, thank you. Okay, so Anne, you are next. I'm sorry I rushed through that. I know that was a lot, but I know we're on time. So go ahead, Anne.
Thank you so much, Stacy. And I just want to say I really appreciated slide 41, factors to consider in setting up a family assistance center. It's just like the best little tip sheet that people could possibly have. So when we post the slide deck, y'all please remember slide 41, super helpful. So I'm going to talk about resiliency centers. I'm also going to apologize. I live across from the Marine Barracks, and the Marine Corps band is playing very loudly. So if you hear John Philip Sousa, that is from across the street. And let's go to the next slide, Angie. So after the Family Assistance Center closes, it's really important to establish leadership for the long-term planning for the potential Resiliency Center. We can't stress enough how important it is to have a partner coordinating council that really does the long-term planning to set up the Resiliency Center. The first question is, can a Resiliency Center be established? Does the community have the resources? Is there the need in the community? You want to think about who's going to host the new organization. It could be a nonprofit organization. Sometimes it's the United Way. In one community, it was a legal services organization. So finding that great organization to host it is really important. Who is going to write the grant? And we know about AEAP grant funding from the U.S. Department of Justice. There's going to be other grants to write to local foundations, state foundations, perhaps state grants to get VOCA funding at the state level, or health services funding at the state level. So grant writing is very, very important. All of my colleagues have talked about who will lead the work. And the folks that lead the FRC and the FAC are not necessarily the folks who will lead the Resiliency Center, but it's important for them to be part of the process in planning for the Resiliency Center. And very, very important is to create an identity and a purpose for the Resiliency Center. When you add up the community trauma and impact, that leads to uncertainty. It leads to a lot of individual and collective fear. And so you want to really think in advance, how are you going to make decisions to address that trauma, to address that uncertainty? So what is a Resiliency Center? I can't stress enough, it is a central hub. And think about a hub that really is foundational for long-term recovery for everybody who's impacted by a mass violence incident. And Resiliency Centers provide comprehensive wraparound victim services, medical, mental behavioral health services, and legal services wrapped around the survivors, and also really important to have navigators, official positions that can assess victims' needs and direct them to the services that are most appropriate for their unique situation. It's really important. Resiliency centers are usually bricks and mortar. It's a building, it's an office, but it's a partnership of people and organizations working together that offer connection, services, and support to victims. And not all the partners will be housed at the Resiliency Center, but they certainly will be an important part of building it and sustaining it. So I'm just going to quickly say, we all love this SAMHSA slide because it really talks about the community phases after a disaster. And when you start looking towards the end, when you're heading towards reconstruction, that is when the Resiliency Center becomes most critical in the aftermath of mass violence. So we probably don't even need to explain this. Why do you need a Resiliency Center? We need to recognize, and my colleagues have, I think, pointed out, there are so many unique aspects of mass violence crimes. There is the large number of victims. There is often the intent of the perpetrator, the motivation of the perpetrator, and the fact that an entire community is traumatized by what happens. That's what makes it unique. We also know that mass violence often overwhelms the existing services and a community's capacity to meet individual and collective needs. And the other thing we know from just years of experience is that the needs of victims and survivors are absolutely better met in a shared space that is dedicated to their unique needs. The growth of resiliency centers, I have to say, over the past 15 years has gone from 0 to, we currently assist 25 resiliency centers across the country, which is phenomenal that we have these wonderful centers. It's also very sad that we have the need for these centers, but a very exponential growth. You can see here, this is the communities that have or have had resiliency centers and programming, again, over the past 15 years. The scope of services of resiliency centers, again, they're going to be unique to the community and to the specific mass violence incident. But in general, I'm just going to quickly review. It's really looking at what victims and survivors need in terms of support, in terms of advocacy, but also being able to help them navigate, which is often very complex systems to get services and support. This could be direct victim services, but it could be accessing Social Security and SSI. It could be contacting the Veterans Administration. There are so many scope of services that victims need that it's important to provide that advocacy. We have learned that financial and assistance and counseling is really, really important. The financial burden of being a mass violence victim is extreme, and very often people need assistance in managing funds that may come into a system, but also assist them, but also to manage the fact that they're going to have some financial challenges often in the aftermath of mass violence. We have learned the importance of legal services, consultation, and referrals. This could be legal services in terms of implementing victim statutory rights, and very often it's looking at more civil legal services needs. It could be intervening with landlords, with employers, and things like that. Dr. Angie spoke a lot about evidence-based behavioral and mental health services, so I'm not going to talk a lot about that. It's just very important to recognize the importance to almost every single mass violence victim and survivor. Resiliency centers are often very, very creative in addressing well-being programming that promotes individual resiliency for victims. And these could be things that help victims learn how to manage stress. It could be things like trauma-informed yoga. The range of services is quite astounding. And again, trying to find out what is most appropriate for the victims that you're serving. A really big part of resiliency centers is the fact that victims and survivors come together. And so there's a remarkable sense of fellowship. And it's hard to explain how wonderful the peer support programming that occurs, how wonderful it is, because victims feel a true sense of connection and a true sense of fellowship when they are with their fellow survivors. Court proceeding support. I'm just so pleased that our center developed a court guide that helps communities, if there is going to be a mass violence trial, helps them go through the court process in a way that is victim-centered and very much trauma-informed. And we are currently updating that guide with the second edition. So we'll be letting you know when that's available sometime in the next year. Then we've also learned that it's important to have first responder specific services. People who immediately respond to a mass violence incident have very unique needs resulting from the trauma of that experience. And so many of our resiliency centers have services that are segmented specifically for first responders so that they can be, again, in fellowship with their fellow responders. What is the structure of the Resiliency Center? It's really important to identify a natural landing spot location for the center, similar to what Stacy said. You want to have it centrally located. You want to have it ADA accessible, and you absolutely want to have a place that's easy to get by public transportation. And again, you don't have to pay $20 for parking. It's also so critical to select a sponsoring agency that has experience in fundraising so they can administer not only the AEAP grant, but also other funds that might be coming in to support their Resiliency Center. We have learned that center directors can have very different backgrounds. They're not all victim service professionals. They come from legal backgrounds, they're attorneys, they come from health and human services, they come from social work backgrounds. And so we've learned that you can build on this variety of experiences and really learn to rely on the skill sets of the leaders of resiliency centers. And the last thing I think is really, really important is to have a steering committee that really can guide you as you're ending the Family Assistance Center and transitioning into the Resiliency Center, that you have survivors, you have people who have been impacted, you have the providers who have been responding and providing services on a committee that can advise you and can tell you what they want the Resiliency Center to look like. It is very, very victim survivor driven, very, very reliant on the experiences of those who have, up to the Resiliency Center, been providing services to victims and to the impacted community. The whole concept of no wrong doors, I have to give a shout out to Victim Services 2000 in Denver, Colorado, really came up with this concept. And the idea is that no matter where a mass violence victim or survivor goes to seek support or assistance, there is no wrong door. They can enter through any of the doors. And it's important to know that that's why partners are just so critical, so that if they go to one of your partners, they can be steered to the physical resiliency center. And here are some examples of beautiful resiliency centers that have been developed across our country. So victim survivor outreach and education, you want to engage survivors early on. You can do this through needs assessments. You can do this through listening sessions. Our center has examples of both to help guide you in this. You want to look at traditional and non-traditional outreach methods. We know a lot of folks use social media for their outreach. We have worked with other communities who literally put posters up in grocery stores and at post offices, literally physical posters that talk about the Resiliency Center. So recognize that how people receive information is going to be very, very different for different communities. You want to look at the totality of a survivor's experience in the impact areas: physical, emotional, psychological, financial, social, and of course, spiritual, and have intentional outreach strategies that really recognize the different types of impact. It's so important that when we're doing outreach, we recognize that people will have vicarious or secondary trauma resulting from the victimization, resulting from responding to the victimization. So it's important to recognize that when you're doing outreach, people go, oh, there's a Resiliency Center. There might be a little hesitancy to go to a place that reminds you of one of the worst things that's ever happened to you individually or as a community. So be very intentional with that. And the last thing I think is really important is to recognize, all good victim advocates know the concentric circles of victimization, beginning with the individual and then immediate family and then friends and neighbors and coworkers. And the circle gets larger until you're really looking at an entire community that is impacted. And I will say from our experience, an entire nation is impacted anytime that there is a mass violence incident. It's important to recognize the needs of mass violence survivors in the communities where they live. They're going to evolve and change over time. Their needs are never, ever, ever static. And as the community moves towards recovery and resiliency and moves towards, really effective strategies that are healing, the needs are going to change. And so good resiliency centers, and we have 25 of them, know that and reflect that in their work. The other thing that resiliency centers are super important and is looking at annual observances and commemoration planning to make sure that these activities are victim center and trauma informed. The commemorations have to focus on the power of the personal stories of those who were most impacted. And some resiliency centers create a unified symbol of resilience, a visual symbol that lets people know that we are united in our grief. We are also united in our resiliency. I can't tell you right now, there's probably 6 or 7 or 8 of our resiliency centers that are currently planning memorials in their community. And I think you all understand the importance of memorials, not just in remembering the event, but in also being able to recognize the impact on the community and to help people share in the experience of healing. And I will say, I do want to recognize the Resiliency and Justice Center in Las Vegas. They have created an incredible process for building their memorial, which is underway. And thank you, Kiara, for putting in their website. We just hope that people will use this incredible resource to be able to look at all the variety of aspects related to a memorial planning. It's not something that happens quickly. It's something that's very detailed. It's something that requires an amazing level of partnership. And we hope that you use the Las Vegas example and the resources therein. Here are just some examples of memorials that have been created. I'm going to talk for a second about our Resiliency Center forums. In 2019, we established our first forum, which was for Resiliency Center directors. And the idea came from Maggie in Pittsburgh, who said we needed to elevate the field of work to establish best practices in care and to be able to learn from each other. Since then, we now have forums for Resiliency Center navigators, for clinicians, for public information officers, and for administrators. And as a bonus point, we have a separate forum for school trauma response and recovery personnel. We have developed, when I say we, I mean all of our forum directors working together, Mass Violence Resiliency Center's best practice guide that documents the extensive work over the past, it's been the past 6 years. And that is currently under review by OVC. And again, we will let you know when this amazing document is going to be available. And the last line here, I think, is the one that is the driving force of our forums. And that is simply people say, it's what I wish I had known when I was just starting out. When people go into this without having the experience, learning from others who have paved the road before you becomes super helpful and super supportive. So I want to talk very, very briefly about strategies to create a seamless delivery of case management and services. Can we go quickly through these? Next slide, Angie. I'm going to give you my theme, and then I'm probably going to go in the interest of time to make sure we have time for answers. It is my favorite fake word. It is coopportunity. The opportunity to cooperate and build partnerships is so important as we're looking at going from the FRC to the FAC all the way to resiliency centers. Next slide, please. And the other thing, and I think this is going to be the last slide because y'all are going to get the slide deck. It's just important that you don't go FRC, FAC, RC, that you look at the transition of leadership. You look at establishing communications in between the creation of each center, which can be virtual. And the third point here is so important, is that you create systems not only for case management, but for all types of record keeping with secure transfer and information and resources from the FRC to the FAC to the Resiliency Center. We've got great examples of client needs assessments for all of the centers. We have really good documentation of lessons learned from folks who have established all of these centers, because it's so important that, that we learn from others' experiences. And we can't stress enough, the last point is the need for continual evaluation for continual improvement. And Angie, I'm going to skip. And I'm going to skip. And I'm going to skip. And I do want to talk briefly about our new virtual resiliency center at the National Mass Violence Center. Encourage you to visit it because it's a great resource for any community affected by mass violence. But we also want you to know that you have the capacity, if your community has a mass violence incident, to create your own personal curated page with resources for your community in the immediate aftermath of mass violence. And we're going to drop into the chat the example of one that was created by New Orleans for the Bourbon Street mass violence incident. We'll go to the next slide. And I'm sorry, I sort of rammed and jammed through my presentation because one of my favorite things of our town halls is to ask each of our presenters, what is one of their recommended strategies or skills for each of you? And Angie, we're going to start with you.
Yes, perfect. Thank you, Anne. Great presentation.
Thank
So
you.
my recommended strategy is that consistency across terminology of the three centers. So across the friends and relative or the friends and relatives center, the family assistance center, and the resiliency center is essential for victims and for allies to ensure that we're serving communities following mass violence.
Great. Thank you so much, Angie. Chris?
Yes, my strategy is that victim services should be a part of response plans and planning so that trained and vetted advocates can be deployed immediately. Keyword being deployed.
And other keywords, trained and vetted. Thank you
That's
so much
right,
for
exactly.
that.
Trained, vetted,
Yeah,
and deployed. Yes.
I love that. Dr. Beers.
I think it's really important for victim services folks to know your emergency management folks in the community. As somebody who's been in victim services for a very long time, I never knew the language in emergencies management. So I would suggest you definitely reach out to your emergency management folks in your county, in your state, and get up on the NIMS training. Take the NIMS training; they are free, so that you can get that language down. So that's what I would suggest.
Great. That is such a great suggestion. My most important skill is to take everything that you have learned today and apply it to our motto, which is know before you need to. We know we've loaded you up with resources today. We encourage you also to visit our websites because your skills are going to be super increased just by being aware of the resources and the free trainings that are available to you. And we are having a few minutes we got so many great questions from the field, and we want to say we are so grateful to you for taking time to submit these in advance. A lot of them have already been answered, but we have some that we thought are little additions for you. And I'm going to start with Angie. I'm going to give you our first question, if that's okay. How can local communities use exercise planning for mass violence that incorporates the three centers that we've talked about? And what steps can community leaders take in advance of a mass violence incident to build and develop resiliency?
Yes, I think a couple of things to say about that. First, know the three centers. So making sure that you yourself know the three centers, which that's a good start because everyone's on here today. But within the community, partnership and that communication and collaboration is enormous. So just because you know what those three centers are and know what you would be doing, making sure that you're having trainings and communications and meetings where everyone is on the same page about what those centers are, because the last thing you want is in the media aftermath of an incident using inconsistent terminology. So within the community, if you decide, making sure the terminology is consistent, making sure that you're having those trainings together and communications to make sure they're consistent, and then exercising those. So having actual exercises where everyone's at the table and you're going through whether it's tabletop exercises or in the field exercises, but going through what you would do in each of those three centers and how each role would play out in each of those three centers.
Well, thank you, Angie. And get on the same page should be our bumper sticker for mass violence response. That is just so very important. I appreciate your insights. Krista, as you know, we had so many questions related to providing services in very, very remote areas and communities where resources are very limited. What brilliant advice do you have for those communities?
Well, I think that's a great question. I actually lived and worked in a rural community for many years in Colorado, and that really was a challenge with the limited resources that are in communities, and also looking at where the distance that they have from maybe a more metropolitan area to access services. And what this goes back to, I know sounds very repetitive, but it is about planning and leveraging partnerships. I love the slogan, know before you need to, and knowing who your partners are in your neighboring communities that might be more resource rich, that can be very helpful, and having them, maybe incorporating them as a part of your local plan and seeing what it is that they're doing and what it is that they would be willing to offer the small communities, as well as training. I know that was something that myself, and working in a rural community, that I very much relied on my neighboring larger partner communities to support. And like I said, having those relationships ahead of time is essential.
Right. And I can say to rural, remote, and tribal communities, Krista, that's where a lot of the national and federal resources also kick in. We know that you are under-resourced, and we've talked a lot about training today. There are just so many opportunities for that. So I appreciate that, Krista. Thank you so much.
And if I could just add to that, Ann, since you brought that up, that and recognizing that there are a lot of federal resources to know what those are ahead of time. So that's part of the plan. So that because it might take a little bit before those resources kick in, but if you know ahead of time where they are, that you can go ahead and take the initiative to reach out for them.
Okay, know before you need to.
Know before you need to. That's right.
Okay. I am going to, boy, Stacy, Dr. Beers, this is a perfect question for you. How do we get victims and families of victims to buy in when the existence of each of these centers is a reminder to them of, what was maybe the worst day of their lives, the potential for the centers being a trauma queue?
I think that that's a really great question. I do think that having a family assistance center that's separate than the FRC is really important. The FAC does not need to be right near the scene. Now, it doesn't need to be the next town over either. And so our goal with the FAC is to actually make it a very supportive environment, having trained providers, victim services providers there to, walk with the FAC through with the victim. I think that's really, really key. So, and I think it's also important to have local community support there. It's great to have all of these national organizations that show up to provide assistance, but when we all leave, the local community is there to support them. And frankly, the local community is those agencies are the ones that really do give credibility to the Family Assistance Center. So I love, it's unfortunate when we have to support these kind of events, but I love working with the local communities in the aftermath of a mass violence incident because they're the experts in their communities.
Yeah, and we have found that communities do rise up to support each one of these centers. It's just a beautiful thing, and I think that's really important to recognize. Thank you so much, Stacy. And Stacy, I'm going to let you, and then I'm going to add on to. We had a lot of questions related to working with hospitals, how to quickly care for the needs of victims' families who show up at the hospitals in the first couple hours, and what are barriers to having really good communications between hospitals and the 3 different centers. If you want to talk from the FBI perspective, I'll talk from our center's perspective.
Honestly, know your folks before a mass violence incident. So for folks in victim services that are on this call today or on this town hall, go meet with your hospital social workers. Start with your Trauma One facilities and go meet them now. Meet with the security at the Trauma One hospitals. A lot of times what hospitals will say is we cannot give you victim information because it's a violation of HIPAA. That is not true when it comes to law enforcement response. So for the FBI, any law enforcement agency, you can have your general counsel write up a letter. The last thing we want to do is subpoena victim information. We've gotten really close in one of our responses because it becomes a barrier between the victim and resources. And so we have letters that our general counsel has written that we can just show when we get to the hospitals. But know your folks before you need to know them in a mass violence incident because everybody wants access. You've got media, you got attorneys, and so the hospitals are just doing their very best to protect the patients, which I completely understand. However, it can become a barrier for service when it comes to serving the victims.
Great. Thank you, Stacy. And I'm really proud to say that the American Hospitals Association has been one of our center's partners since 2017. And over the past couple of years, we have developed, and it is going to be published very soon, a guide for leaders of hospitals and healthcare systems that looks at mass violence preparation, response, recovery. And they don't use resilience, they use the term mitigation, talk about being on the same page. And so we're going to have a very good, detailed, specific guide available soon, and possibly a national town hall in the future that looks specifically at the issue of hospitals and healthcare systems. And that's all the time we have for questions. We're going to go to our next slide. So we say throughout this town hall that we are available for consultation, training, technical assistance. We ask you to reach out to us. We are here to serve you. The strength of our mass violence readiness, response, recovery, and resilience is something that is at the local level, all the way up to the national and federal level. And so please let us know any needs that you might have. Wrap up and evaluation. After the last slide goes on, a survey is going to magically appear. It's just going to take you a second to complete the survey. And we ask you to do this because we want to know if this information was helpful, but we also want you to help us identify topics for future national town halls. So I want to say thank you so much to the team at NMVC who put this together. I want to thank our rock star panel of presenters today. It was just amazing at how much information you crammed into 90 minutes. And of course, I want to say, as always, thanks to the Office for Victims of Crime and to Eugenia Pedley for your ongoing support and your commitment. Thanks to everyone for attending and all the hearts and balloons that I'm seeing in my end. We certainly appreciate. Good day to all. And take the survey.